surgical robots? Wait, what? I guess that's pretty cool. Well, let's see. The 1985 Puma 560 robot was the first documented use of a robot-assisted surgical procedure. It was a surgical arm used in a delicate neurosurgical biopsy. Because there is no documented video of the 1985 surgery, this is a video of the Puma machine that would have been used in the surgery, but this Puma machine is just in a different setting, being used for a different function. But in the video, you'll see how it moves, and this Puma robot would have moved the same way that the Puma robot in the surgery would have moved. The 1992 RoboDoc was the first to do a total hip arthroplasty. The RoboDoc follows a list of steps to make sure that the surgery is more precise. The first step being a CT scan of the patient's operative hip joint. And the second step would be the planning, with the OrthoDoc workstation where the CT data is converted into the 3D model of the femur, then the surgeon can select an appropriate implant. This is all done by looking at the screen and the monitor. This robot allows the doctor to have a more wrist-like function when doing the surgery. The 2000 history-breaking Da Vinci robot. This robotic system made history being the first robot surgery system to be approved by the FDA for general laparoscopic surgery. The three-dimensional magnification screen allows the surgeon to view the operative area with more clarity and higher resolution. With smaller sized arms than the Puma 560, it allows for less contact between the exposed interior tissue and the surgical device, reducing the risk of infection. To give you an idea of how precise this robot could be, here is the Da Vinci robot taking the skin off of a grape. The Da Vinci system is not the only impressive system. There is another impressive system, the Precise Eyes surgical system.
Precise helps vitreoretinal surgeons improve their precision of movement by a factor of 10 to 20. This enables surgeons to perform new procedures and promises to enhance established procedures. The precision of Precise enables surgeons to perform vitreoretinal procedures that they cannot perform by hand.
Now that I've given you a general idea about these robots, let's talk about their pros and cons. Some of the pros about surgical robots include shorter hospital stays, and we all know how expensive hospitals can get the longer you stay, smaller incisions, which leads to less pain and discomfort, reduced risk of infection, less blood loss and transfusions, minimal scarring, greater visualization for your surgeon, also greater precision for your surgeon, and a high degree of dexterity, allowing the surgeon the ability to operate in very tight spaces, giving them more options. Some of the cons about surgical robots include the surgery taking longer than it should, the cost not being a fixed amount, meaning it may cost more than just having the regular doctor do it. Technology complications are able to occur during the process. Also, power problems or malfunctions can occur during the surgery. Now the real question is, based off everything you learned from this video, would you trust a surgical robot doing your surgery? Thank you for watching. I hope you learned a lot from this video.